Hi everyone. Today's topic we'll discuss that is encephalitis. Uh, encephalitis that we have to know. Encephalitis, that is a inflammations of the brain. Okay, so encephalitis, that is a serious and potential life-threatening inflammations of the brain. Usually that is caused by a viral or bacterial infections. Okay, so that is the I told you that is the inflammations of the brain, inflammations of the brain caused by viral infections. And also it can lead to a like a neurological damage and various symptoms affecting central nervous system also. So under that, in encephalitis, under that we will discuss the definitions of encephalitis, causes, sign and symptoms, and diagnostic evaluations, medical managements, nursing managements, complications and preventions. Okay, so let's see the definitions of a encephalitis. So already I told you that definitions of encephalitis, that is the inflammations of a brains. Okay, and that is a serious and potential life-threatening inflammations of a brain, uh, which is caused by a viral or bacterial infections. So encephalitis is a inflammations of the brain often caused by viral infections. It can lead to a neurological damage and various symptoms affecting the central nervous systems. So next we'll see the causes. So main causes is viral infections. Okay, so viral infections here, such as most common causes include the viral infection, that is herpes simplex virus, HSV, and arboviruses, example like West Nile virus, and bacterial and fungal infections. So the bacterial and fungal infection, that is less common infection, less common. Bacterial infections such as like streptococcus, pneumonia, hemophilus influenza, and fungal infections, uh, fungal infections such as like example of fungal infections like cryptococcal meningitis. And the next causes autoimmune response. Sometimes the body immune systems mistakenly attack the brain tissue. And next is a post infectious encephalitis. So post infectious encephalitis, that's following an infections, the immune response can lead to a inflammations. So these are the main causes of a encephalitis. Next we'll move on a sign and symptoms. So the sign and symptoms of a encephalitis, that are early symptoms is there and neurological symptoms. So in early symptoms, there will be the fever is there, headache, fatigue, nausea and vomitings. And next is a neurological symptoms. So confusions, seizures, change in behavior or personality will occur, sensitivity of light, stiff neck, indicating possible meningitis. So these are the signs and symptoms of a encephalitis. Next we'll move on a diagnostic evaluation. So in diagnostic evaluations here, first of all we have to do that is a history collections and physical examinations. And next test, that is a lumbar puncture test or spinal tap. This test is done for analyze the cerebrospinal fluids for sign of infections or inflammations. And next is imaging studies. So under the imaging studies, MRI or CT scan, to identify brain swelling or lesions. And next is a blood test. So blood test is required to identify the viral or bacterial infections. For that we require for blood test. Next we'll move on medical management. So under the medical management here, we can provide the antiviral medications because encephalitis is caused by a viral infections. So for viral causes such as like acyclovir for herpes simplex encephalitis. And next medications we can provide antibiotic because antibiotic also we can provide for bacterial infections. And next is for supportive care, management of symptoms including like hydrations, pain reliefs, and antibiotics medications. And next is corticosteroid may be used to reduce the inflammations. And next is seizure management, anti epileptic medications. Next we'll see that is the nursing management. So in nursing management here we have to monitor vital signs, neurological as status, and level of a consciousness. And next supportive care is required. And next patient's education is required, and rehabilitation. So these are the medical nursing management. Next we'll see the complications. So complications will be neurological deficit, seizures, death. Next is vaccinations. So in vaccinations is required vaccination for preventable viruses. And next is vector control.